Joining me now to debate whether the president's plan will improve health care and lower costs, two congressmen with two very different views, as is wont to happen with a debate. Congressman John Shadegg, he is Republican of Arizona. The congressman says the plan will not lower health care costs. Good to have you with us. Congressman Jerrold Nadler, he's Democrat of New York. He says he supports the president's plan. Gentlemen, good to have you with us. Let's turn to the first issue. First, I just like to understand, Congressman Nadler, is this deadline, was it the people's deadline? Was it the president's deadline? Or is Senator Harry Reid absolutely right that the media imposed that deadline of the August recess?
No, I don't. I think the only real deadline is that we should do it in this Congress or by the end of the year. Certainly, it would have been nice to have a bill pass both houses by the end of the recess, but the real factor that stopped it was that even had the Commerce Committee voted out a bill a week ago, it takes about 2 weeks to unite the three bills, to get a score from the Congressional Budget Office, to go through the Rules Committee, put the proper notices. Just mechanically, it couldn't happen. So,
not happening. Congressman Shadegg, do you think the poll numbers, the American people in every single poll, are rejecting health care as it stands right now and presented by this administration? The president's poll ratings are down. Is that playing a role, or is that irrelevant to the course of events for health care legislation?
I think his poll numbers are down in part because of the bill itself. This bill is old think. President Obama got elected promising change. He said he was going to make Washington very different, get out the old forces and the old partisanship, and bring a new kind of view of the world to Washington. I'm very sympathetic to that, even though I'm a Republican, but this bill is old think. Instead of bringing reform from the bottom up, empowering people and enabling people with a pre-existing condition to get health care at the same cost as everybody else, covering all Americans, and empowering the average American to be able to buy their own health care plan, and those who don't have the money to buy it with some assistance from the government. This goes back to the way Washington always works. It's top down, it's bureaucrat heavy, and it's all kind of Washington is going to command and control everything.
With all due respect, that's a tissue of falsehoods from beginning to end.
Oh no, it's not.
First of all, I've read the bill. First of all, the president campaigned very specifically on this bill, not the bill number, but the concepts in this bill were gone through in the Democratic primary between Hillary and Edwards and the president, and they all agreed more or less on it. And second of all, in the general election, this was debated. And what this bill says is, you can keep your current insurance.
No.
You can. Let me finish, please.
You
can keep your current insurance. Especially if you're employed by your employer. But it will put requirements on the insurance companies. It will say, no more conditions that you can't get insurance for pre-existing health care. No more out-of-pocket expenses above $5,000 a year for a single person, or $10,000 a year for a family, even if you have a health catastrophe. If you lose your job, you'll be able to go and buy a new insurance policy, regardless of pre-existing conditions, from private insurance companies or from a public option.
Congressman Shadegg.
The bill specifically says that every existing insurance plan in America, whether it comes from an employer or whether you buy it in the individual market, must change within 5 years. It grandfathers them, but only for 5 years. And at the end
only
of the 5
change
years,
it mandates is that they can't refuse your coverage
for we've got plenty of time for you both. Please, gentlemen, we have time. I promise you'll get plenty of time.
No later than 5 years, it must meet literally dozens of federal requirements, not state requirements like they used to, but new federal requirements, many of which have been created by a board that doesn't even exist yet.
Congressman Nadler, I promise you both. I promised you both there'd be plenty of time. I've just been, well, I am just utterly wrong, because we've just been given a 2-minute warning. Sergeant James Crowley is going to be speaking before the cameras. I apologize.
The requirements on these policies are exactly what I said they would be.
No, they're not, Jerry.
Namely that they can't deny.
Every plan must change within 5 years.
Sir, you going to allow me to talk at all? Namely, that they can't deny pre-existing coverage. They can't have...
We're agreed on pre-existing conditions.
They can't...
I said that to begin with.
But Fine, we're
Jerry,
agreed.
don't
But that's what
misrepresent the bill.
I am not misrepresenting
Yes, you
the bill.
are.
That's what the bill says.
Read the language of the bill.
I
It
have
says
read
every
the
plan
language
must
of-
change in 5 years, Jerry.
Yes, within 5 years they have to meet
right.
these requirements that I'm saying.
Thank you.
Let me ask you, that being the case, and as we look at these poll numbers on the handling of health care policy, Congressman Nadler, the president's approval rating, you all are going to be going back to your home districts there in Congress. There is, obviously, given these polls, there is great anxiety and concern and opposition right now to health care legislation.
There's a great deal of falsehoods and lies being spread about this bill by the Republicans and by other interest groups, by the insurance companies who don't want to have to not discriminate against people based on pre-existing conditions. There's a lot of money being spent against it. I think and the president's popularity is down not because of this, I think, but because of the economy generally. But I think when people go home and they hear more, when the members of Congress go home and they explain what's in this bill, which is essentially what the president promised during the campaign last year.
A fine on businesses as small as 2 employees? Yeah,
there is not going to be a fine on employees.
I welcome the American people learning what's in the bill.
There is not going to be a fine.
Yes, Jerry, there is. There's a fine on it.
No, there isn't. No, there isn't. There's no fine on small businesses. What there is...
You obviously have not read this bill, Jerry. There's a fine on any small business, even down to 2 employees, if they do not provide coverage to their employees.
That's not correct. That is not correct. What there is in this bill is...
the American people need to read the bill because you're not reading the bill I'm reading. That fine is in the bill. It's in the first 47 pages of the bill.
Listen, you can say anything you want what's in the bill, but if you're not telling the truth about it, you don't let me correct you, it doesn't matter.
I am telling the truth about the bill, and I don't appreciate your saying that.
But
I
you
hope
won't
the American people will read the bill.
Fine.
Because if they read the bill, they'll find what I've just told them.
What the bill says is that companies above, with employment above $250,000 level, and the Energy and Commerce version says above $500,000 level, they have to, if they don't provide health insurance to their employees, have to pay into a fund to pay for health insurance for their employees.
So you can see the point I just said.
No, well, if they're paying more than $250,000 payroll, or
you can have 2 employees and be paying more than $250,000.
Yeah, if each of your employees gets $125,000.
That's right, Jerry.
Most employees don't.
So a business as small as 2 employees can be fined under this bill if they don't offer insurance. That's what I said. You said I was misrepresenting the bill.
A business with only 2 employees, each making over $125,000, I assure you, is giving those 2 employees health insurance.
But the point is...
May I interrupt, gentlemen?
Sure.
I just got one question. First of all, I've got to believe that the audience of this broadcast is impressed that 2 congressmen have read the legislation when it's been very clear that so many congressmen and senators are not reading legislation. For example, John Conyers, as chairman of the Judiciary Committee, saying that he couldn't understand why anyone would bother. We're delighted that you did, and we compliment and commend you.
Thank you.
But let me ask you this. The issue of crime, and you raised this, Congressman Nadler, the lies, the president saying much the same thing, and distortions here. Definitively, what will the bill cost, and what will it actually save? We've heard the president's numbers. We've heard the Congressional Budget Office present quite a different perspective.
Well,
what is the reality?
First of all, the Congressional Budget Office was commenting on an earlier version of the bill. The comment on the later version of the bill with the public option was much better. The bill is entirely paid for, with the exception that in the bill is a postponement, or not a postponement, a cancellation of a reduction in fees to physicians, which we will do with or without the bill. That will cost about $245 billion over 10 years, with or without the bill. The bill itself is entirely paid for under
I'm going to have to say,
rules.
Congressman Nadler, thank you so much. Congressman Shadegg, thank you so much. We appreciate you gentlemen being here. Obviously,